run option. Congressman John Yarmuth of the House Budget Committee joins us now to talk about this and also the unfolding situation in Iran. Congressman, we'll start with health care. A lot of GOP criticism out there today. How do you respond?
Well, you know, it's pretty clear what the Republican strategy is. It was outlined in a Frank Luntz memo of 28 pages about a month ago, which is basically, it said, we know the American people want dramatic health care reform. We know that we can't afford to let the Democrats have a victory, so we have to do everything we can to stop it. So it's become a position of just say no, as you heard my constituent and my senator, Mitch McConnell, say. That's all they can offer. They really haven't had a plan. So what we're doing is forging ahead. We know that if we don't do something dramatic to reform health care in this country, as Christine Romer said yesterday in testimony before our committee, that health care will be 35% of GDP in another 30 years. That's unsustainable. We know that if we don't do anything right now, the projection is an average family life and our health care policy in 8 years will be $25,000. That's not sustainable for virtually any American family or for any American business. The time to act is now. We don't have an alternative.
Congressman, you say the GOP hasn't had a plan. They claim that they have one now. We're also hearing some Democrats on the Hill saying that they have been told not to work with Republicans. They don't have a seat at the table. Is that going to be a good way to get this done? If you're going to sell it across the board to the American public, not as just a Democratic plan, but as a plan from the Hill, from Washington?
Two points on that. One is I don't know what my friend Jim Cooper is talking about. I'm on the Ways and Means Committee also. We've had a session with the Republicans. We've invited them to bring their ideas. We met with them. They really didn't have many ideas. We all agree on the problems. That's the good thing. We had a meeting scheduled the other day with Republicans again to talk about their ideas, what we might be able to incorporate. They canceled the meeting. We're trying to get Republican cooperation in this effort because we know that unless it's broadly accepted, it's not going to be easy to pass. So that's where we've been on this, and I just think it's really unfair to say. We're looking for the best ideas wherever they come from.
All right, 850-page plus plan. Mm-hmm. A lot of details in there, but not much on how you're going to pay for this. How will you pay for this? Well,
right now everything's on the table. We're considering a wide menu of options. Part of it, roughly half or maybe a little more, will come from restructuring of some of the existing government programs, some of the reforms that are in the document that was released yesterday. That's supposed to be somewhere between $60 and $90 billion each year for 10 years. And then there has to be some revenue increases as well. And again, there's a wide variety of things being considered. Various taxes, for instance, on soft drinks, sugared soft drinks, from eliminating the employer deduction for health care premiums for the very wealthy citizens to a surtax on people making over $250,000 a year. We know that any of those measures are going to meet with resistance, but we hope to be able to put together a package that we can convince the American people is worth it because, again, the option is really not to, there is no option to do nothing. We have to act.
All right, a busy summer ahead, no doubt. Congressman John Yarmuth, yes. Thanks for your time.
Thank you.